This is No Spin Live, and we're going to be talking about the Aesthetic app, brand new for patients. An unlicensed medical practitioner once again causing problems in Florida. And finally, Britain reviews BBL, and we got some great experts to kind of tell us what's going on with these topics. We got Dr. Lee Thornton from Meridian, Mississippi, Dr. Ned Snyder from Austin, Texas, and Dr. Jason Posner from Boca Raton, Florida. We're just talking, guys. Lee, your son's a budding Angus Young / Eric Clapton.
Dwayne Allman, probably. He'd like that better, Dwayne
We
Allman.
just want, Ned and Jason and I just want to have it memorialized on TV that we get tickets when he, for his first big concert.
You're in. Absolutely.
All right. I will hold you to it.
All right. Good stuff. But listen, let's get into this. So this was just announced last week on a press release. The Aesthetic Society is through a grant that came from Allergan, putting together something called the Aesthetic app, which is for patients. And we all know that patients with breast implants for many years have had issues keeping track of what implant there is, what size, detailed information, collecting data. All of those things have been things recently discussed, particularly at the FDA committee meeting. So Jason, what do you think about this? It sounds like big news. What are your thoughts?
This is like the first I heard of this. So I think like this is it's really interesting that we actually have an app that keeps track of all the breast implants. And I think it's going to be really good for the patients and the physicians to be able to keep track of things, because how many times does a patient come to your office and they tell you that maybe they have this implant and maybe it was done. It'd be so nice to be able to look it up online in 10 or 20 years from now and have, consistency in the reporting. So I'm really looking forward to having some consistency and being able to not have to have people search for pieces of paper that they can't find.
Yeah, Ned, what were your first thoughts when you learned about this?
Well, exactly the same lines, to have an accessible database that keeps track of all of this information, meaning that if somebody has 10-year-old implants, rarely do we know what they are. Patients don't keep track of cards, meaning those little cards that we give them are just something that's too easy to be lost. Medical records are only kept for a certain amount of time within a doctor's office, and it's really relatively new that there's been an effort to create a sort of a permanent database keeping track of medical devices. And this one will be accessible, meaning that any patient will be able to access their own information, as well as their doctors should be able to do the same.
Yeah, we all know just from our kids, like they're all the time, they're on this, and so are most of the adults. But everybody does stuff on their phones, so this is all via mobile units. If you want to, Lee, like if you have a survey, you're collecting something from some of your breast implant patients, you'll be able to do it via that app. And sometimes the patients don't have their information. Sometimes they were never given it, so it's just going to alleviate a lot of those little pitfalls that happen.
Yeah, one other thought I have, though, is, when I first read this, I thought, no surprise, because it's ASAPS. And, I firmly believe that the ASAPS is the best medical professional organization that I've ever seen or heard of. We are proactive. We're on top of things like this. And, I also thought this is going to be the beginning of this app. There'll be a lot more in terms of patient education and ability to communicate on this app. So, I think it's an awesome thing that they're doing. I think they realized a need. They went ahead and proactively started it. And that's why the ASAPS is what it is. It's the premier aesthetic organization in the world, and everybody that really knows aesthetic surgery knows this.
No, I totally agree. So it should be great stuff. All right, well, let's move on. So Jason, what the hell is going on in Florida? Once again, another unlicensed medical practitioner doing something. So explain what's going on here.
As far as I understood it from the article, it was another unlicensed medical practitioner did something bad to a patient, and the patient had an adverse event. It's just that Florida seems to be the gateway for all of these procedures. We never hear unlicensed California or unlicensed New York or wherever else, or Texas. It's always in Florida. And I think that it's just I think it's really a Latin American thing. I think there's a lot of Latin American healthcare practitioners who come up from other countries who may or may not have been licensed. They're not regulated. They do things in their garages and their bedrooms, and the patients suffer from it.
I mean, they had a complication. Yeah, they were in a coma for freaking months. It's like that sounded really scary. Luckily, they woke up, and then they actually found out what the deal was, because nobody really knew. They were just found down
they almost died, according to the article. I mean, it sounds like they did. And I want to point out to Jason that ironically this lady was first arrested in California and then moved to Florida because it seemed to be a place that was easier for this kind of thing to be done. But yeah, every time you hear about it, it seems like it's Florida.
How do people not fall into the trap of going to an unlicensed medical practitioner?
Well, over the years, I've often said people will research their new car purchase more than they will the credentials of their surgeon, which is really a shame. And, I think that we're still in that time where a lot of people really don't have an idea of what good training is and, what board certification means. And, they hear word of mouth that somebody's doing this procedure cheap and, somebody had a great experience with them, whatever, or they fall prey to an ad, which is very often the case. And, then they find themselves in this situation. I'm sure every one of us have been involved multiple times with people in our practice who, had similar things happen, some even by physicians, but not properly trained physicians and properly certified physicians. So, it's just, again, another example where people do, just like Jason said, need to do their homework. And, the states really need to crack down on this. And, even one step further, I think that we're all seeing, non-core practitioners doing aesthetic services and in some cases surgery and having poor outcomes, and it's really not regulated very well.
Yeah, well, this one, I'm not sure what the deal is, but sometimes it's like really out there, like these people aren't doctors, and that tends to make the news. But or we had the one where the person was doing treatments and their waiting room was the Krispy Kreme donut next door. If you see that's a red flag, right? That you probably shouldn't sign up for that. But sometimes it can be tough, and there's a lot of marketing out there, and people sometimes look legit, and so you just have to be. I think patients just need to be really critical about who they're going and ask the questions and talk to people and talk to other patients that have been to see that person and really try to do their homework.
Right.
Board certification matters. I mean, I think
board certification.
Important.
And what Lee said earlier, are you an ACEPS member? Are you an ASPS member? How many of these procedures do you do? This is the course of your normal practice. Have you not done one in 20 years? Maybe those certain questions the patients need to ask.
Yeah, good stuff. All right, well, this is last story. This is on Brazilian butt lift. It's been under a lot of scrutiny. We've talked about it actually for the past couple of years quite a bit. There was a study that came out that showed the death rate was as high as 1 in 3,000 for Brazilian butt lifts from fat embolism is usually the mechanism. But this was in Britain, and they've had a lot of issues with safety issues there, and they were discussing it amongst the professional society in Britain called BAPS. And actually one of our good colleagues that's been on No Spin Lives many years, Dan Delvecchio, actually flew to London, and he presented. I think Dan was probably instrumental in them, they were kind of anticipating they were going to vote to ban the procedure, and I think after Dan's presentation they decided they wanted to look at more data and science. So Jason, what are your thoughts?
I mean, we've talked about this numerous times, and I'm sure that in the US we do far more Brazilian butt lifts than any place else, probably even more than Brazil. And we've definitely had our problems, and Bill, you've been involved with this from the society standpoint, and Delvecchio has been. I mean, we have certain guidelines that we adhere to for safety because there were problems. So the societies got together, they did cadaver studies, they looked at the autopsies, and they figured out what was going wrong, and they presented us with guidelines to provide safe surgery to our patients. And that we're all following those guidelines. No intramuscular injections, keep the injections lateral, things like that, in terms of small cannulas, no big dental cannulas. So certain things we do to provide safe results. So I think it's only a matter of time before other countries, evaluate this and catch up. I mean, what they should just do is, look at our guidelines, because we've been through far more of these than any other country has.
Yeah, I mean, Ned, one of the things that I know Dan, when I spoke to him yesterday, he said he talked to them about is that originally, there's some data that said there's 1 in 3,000 death rate, but there's actually been quite a bit of education. We've learned in the past year that basically if you inject in the subcutaneous layer, not into the muscle, that there's very low rates of fat embolism. So the death toll actually now, currently with current techniques, is about 1 in 20,000, not 1 in 3,000. So education and techniques seem to be important for that procedure. And I think that was Dan's message to the board of the British Association of Aesthetic Plastic Surgery.
Not different than any other procedure that we do. Technique matters. And I think that that's an important take-home point from this. You need good education. You need a surgeon that knows what they're doing. And probably someone that does a lot of these. Going to someone who does a relatively high volume probably makes a difference as well.
Yeah, no doubt. Lee, what are your thoughts?
I'm going to sound like a broken record, but, again, Jason's right. Our experience with this here is big. Most of us started with small volume fat injection in the face back in the late 90s, kind of progressed to breast cancer reconstruction, and then larger volumes like the Brazilian butt lift became more popular. I think problems were recognized by us in the United States early on. We had a task force with the ASPS and ASAPS that looked at this, pretty quickly sorted out what we thought was the main reason, just like you said, intramuscular or deep injections, started correcting that and educating. So, I think that good for the UK that they didn't just knee-jerk ban the procedure. It's great that Dan went over to help educate, and now they're, going about this in a kind of organized scientific way. If they were going to ban it, maybe ban it to everyone except for board certified plastic surgeons over there, and they'd cut their problems down very, very quickly, which is really what we should be doing here as well.
That's an interesting thing to talk about too, because American Airlines doesn't hire drone pilots to fly their jets. It just doesn't happen. And that makes perfect sense to all of us, but people want to argue about why shouldn't it just be board certified plastic surgeons doing these procedures?
Yeah, I think to us it's very clear on our side of the fence, and we get a lot of pushback, of course, from other doctors. But I guess technically any of us in our surgery center could do a intracranial procedure on the brain if somebody would let us do it. But fortunately, we're ethical enough not to do those things. But unfortunately, there's a lot of people that aren't. So I think there's no question that we should push more for, these procedures being limited to those who are trained for them. If I'm having a craniotomy, God, I want a neurosurgeon doing it. If I'm having my heart operated, I don't want a board certified, trained cardiovascular surgeon. And it's the same with plastic surgery, but, because much of this is outside of the realm of insurance, it's cash pay, some can be lucrative. It's very popularized in the press. You can go on YouTube and watch the procedure. This is part of the reason that we have these problems. Since we don't have stricter regulation, that probably has to start at the state level and then progress from there.
Yeah, that's some great points. Well, listen, appreciate you guys' time. I'm sure everybody enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.